Prescription drug abuse considered a growing epidemic by the Centers for Disease Control and Prevention.
This epidemic now impacting our smallest citizens. More and more babies are being born going through withdrawals caused by their mothers using prescription drugs during pregnancy. Well, a new law is intended to determine the depth of the problem and the best way to fight it. But some fear that law will one day tear mothers and babies apart.
I felt so guilty that he was going through that, and I did that to him.
Little Aiden Zane spent his first few weeks of life hooked up to machines in intensive care. This as nurses weaned him off methadone, a drug doctors prescribed his mom Liz Stewart while pregnant to get her off painkillers.
If I didn't take them, I was physically sick, gastrointestinal problems, and didn't really feel like getting out of bed.
She started taking prescription pills 12 years ago to help cope with a series of painful jaw surgeries.
And I remember the doctors telling me, watch out because these can be addictive. I just remember thinking to myself, well, I'm not going to get addicted to these. Nobody sat down and said, no, your body can get physically dependent on these.
Liz admits she was dependent and needed painkillers to keep up with her 50-hour work weeks and busy lifestyle. When doctors quit prescribing, she got them on the streets. But that all came to a halt last year, a life-changing bombshell filled with confliction.
And all I could think to myself was, can I live with this decision? Can I kill this baby or give it up and be okay with myself? And I knew that if I did either one of those things, that would be something I couldn't recover from.
Liz is still recovering. She credits caring doctors for getting her on a methadone maintenance treatment plan, a plan backed by the U.S. Department of Health and Human Services. The agency says methadone blocks the effects of opioids and symptoms of withdrawal, which can be fatal to a baby in the womb and doesn't cause birth defects. But it could put the baby through withdrawal, called neonatal abstinence syndrome.
It's difficult. They're very irritable. They're very sick, and some babies can have seizures, and the concept of weaning them off can be a very long term, and it may take weeks and even months. So these babies may spend as much as several weeks or months in the hospital.
Dr. Maria Del Rio Hoover says she's seeing more and more babies born with NAS at St. Mary's Hospital, where she's a neonatologist. She feels more needs to be done to help them and their mothers.
There are no services, very minimal services for pregnant women right now, women on Medicaid, that most insurance providers do not pay for these services, and we don't have a good grasp on these babies.
To get a better grasp, the Indiana legislature recently passed a law that directs a task force to figure out how to best track babies born with neonatal abstinence syndrome. They'll also officially define it to create more consistency.
Tracking and reporting might be helpful for politicians, but it's not particularly helpful for improving health care.
The nonprofit National Advocates for Pregnant Women is concerned this law could one day send mothers to jail. That's what's happening in Tennessee. Lawmakers noticed a spike in NAS cases after it started being tracked a few years ago. Now, a new unprecedented law allows prosecutors to charge women with fetal assault.
What started out as just tracking and reporting, ostensibly for the purposes of improving public health, quickly can start to look like a pretext for punishing pregnant women, and that's really scary.
Liz had her own scare.
It was the second weekend, a lady walked into my hospital room and said, "You're really lucky because normally when you see my face, I'm here to take your baby."
Her doctors and nurses vouched for her, so Child Protective Services didn't file charges. But it was an emotional journey.
I had to eventually give myself credit that he was there. He was alive, he was healthy, and he was very happy. And the baby he is today is not the baby that he was when he was born. He had to struggle a little bit, but he made a full recovery, and nothing was permanent, and it wasn't all for nothing.
State Representative Gail Ricken of Evansville co-sponsored the legislation. She tells me the goal is strictly for medical purposes and doesn't want to scare women out of getting help.
So what's next for this task force, Tina?
Well, they're supposed to reveal their findings in November. From there, a pilot program will be created to track these babies at 1 or 2 hospitals in Indiana, but we don't know what hospital that will be at just yet.